Hey everyone, this is going to be a little different. I want to address one specific topic in this video. I mentioned in my last audio post that it's really frustrating to watch certain people come out with private messages from years ago, and people are willing to overlook multiple things about this. Certain people around here pull out personal messages that were sent years ago and were messages sent to someone in private that they thought they could trust and confide in with their most private thoughts and their most private feelings that they shared with them because they thought they could trust them. So now, years later, those private thoughts are weapons to use to hurt, embarrass, and make people turn away from that ex-friend. And what's really fucked up is that nobody stops to think that no matter what that person is trying to expose, they were okay with it for years. They sat right next to that person and went right along with it. But when they expose messages, they leave their side of the comments out, or they will show their side, but everyone is so happy this person is releasing info on their quote enemy that they will overlook anything else said or done if it wasn't said by the so-called enemy. The other person could be the one doxing or threatening, but that will all be overlooked because everyone wants them to keep releasing more. It's a completely hate-driven behavior. We don't know what is being said to get the responses when they don't show the whole conversation, because unfortunately, people pretend to be friends, but actually are just in the friendship to stir up drama or frame the other person for further exposing. And I personally don't ignore the other side of the conversation. If you are exposing private messages between you and someone that thought you were their friend, you don't get a free pass. You don't get to get away with all the nastiness in the messages just because you're exposing them. This is why some people don't put their side out, because they want to maintain their appearance of being the good one, so they can't put out their side of the messages that we're agreeing with, participating in, or even instigating the message thread. But anyway, I'm tired of seeing one thing weaponized over and over and over, and that is faking cancer. I cannot tell you how many times I've seen this used as a reason to hate Granny. And it's used by people in numerous places, even outside the community. There are a certain small group of people who push this out constantly. People start defending Granny. Oh, better repost that video that says Granny fake cancer. Granny's getting sympathy. Better repost that video says Granny fake cancer. Granny's getting some attorney donations. Better repost that video saying Granny fake cancer. Granny says something that makes one of them mad. Better repost that video saying Granny fake cancer. That's what they do. That's what they use it for. And I'm over it. There are two main videos that push the narrative that Granny lied about having cancer. And they get played over and over by BJ, and they get linked in community posts by a few other big Granny haters. The clips chosen paint a picture the way they want it painted. I'm going to explain some of the details. I'm sick of going into chats and seeing things like, quote, I don't talk to people who fake cancer. Or, quote, she fake cancer. Why would anyone listen to her? Or, quote, one thing I'll never fuck with, and that's someone who fakes cancer. Because that is what they have successfully reduced her to, is a cancer faker. So I want to explain some of that to you. The lie about faking cancer has spread far and wide. It has affected Granny's reputation and opportunities here on YouTube, which is her main income. It's a false statement that is so damaging. You don't have to show loss of income to pursue a defamation case because it's one of those statements that is so damaging. It's known that it is going to cause reputational damage. No proof needed. You just know if you're going around saying someone did something so egregious, it is going to cause harm, okay? It's not something to play with. It's not something to play semantics with. There is medical proof of cancer on paper, and so the community posts saying she lied are defamatory. And the court doesn't care about semantics of whether she said full-blown and what she meant by it, or the fear of what happened and what she said because of that fear. They don't care about that. What they care about is the medical proof and the lie that's being told. So let me break this down. Let me explain a little about cervical cancer, diagnosis, treatment, medical terminology, etc. I've been a registered nurse for over 20 years. I'm not an expert in oncology or GYN. I'm not. However, I've worked in hospice for a large part of my nursing career, and I have taken care of all kinds of cancer patients, and I have helped their families with their diagnosis and understanding and dealing with end-of-life topics, and also working closely with a doctor that is the medical director of hospice, with working with him to take care of these patients and treat them effectively. I also worked in surgery for 4 years at the beginning of my nursing career, where we did treatments and surgeries on patients who had cancers of various parts of their body. So I'm going to speak about this from my knowledge, my point of view, my experiences as a nurse, and my experiences as a person, as a mother, because I have had family members that have had cancer. I have had friends that have had cancer. I have had personal experiences with that. So I'm going to be speaking from that point of view as well. Um, so after being on YouTube for over 5 years, I've learned that people hear and interpret things very differently, depending on whether they like or dislike a person. I try to view things objectively, but I can admit that I don't always accomplish it. So, what I mean is, if someone makes a statement, the people who like the person making the statement hear one thing and are open to explanations and corrections. The people who dislike the person that's making the statement are going to take it very literal and look for mistakes, misspeaks, and questionable details. That's just how it is. So, of course, when Granny spoke about cervical cancer, some people were examining every syllable with a microscope, and some were just concerned and understood the emotion involved and understood misspeaks and misunderstandings. I actually watched people who supported and defended Granny at that time suddenly turn and accuse her of lying a year later when they decided they don't like her anymore. So, first, I want to say that to all of the people saying that she faked cancer to distract from a situation that was happening in the community at the time involving journal entries of a child being shared. How did she fake abnormal test results and the symptoms that made her go to the doctor at that time? How did she plan that exactly at the time that coincided with this happening in the community? People get ridiculous when they decide to hate someone. So, according to them, Granny developed these symptoms, went into her doctor to be examined, had suspicious findings, had to get further testing and another procedure done, all to distract from something happening on YouTube. So, let me explain first a few medical things about cervical cancer and HPV. I'll start with HPV because this is the thing people want to come at Granny about. Now, Granny has spoken about this, so I don't think that I'm revealing anything by talking about this. HPV is extremely common. Nearly everyone will get HPV at some point in their lives, according to the CDC. More than 42 million Americans are infected with types of HPV known to cause disease. About 13 million Americans, including teens, get infected each year. HPV is spread through intimate contact and can be spread even if there are no signs or symptoms. Most HPV infections, 9 out of 10, go away by themselves within 2 years. But sometimes HPV infections will last longer and can cause cancer. This is why the HPV vaccination was created, because HPV is so very common and it can lead to cancer. So it is a big deal in this country. Every year in the United States, HPV causes about 36,000 cases of cancer, and there's no way to know who will develop cancer from it and who won't. HPV causes about 10,800 cases of cervical cancer each year in the US. Nearly 200,000 women are diagnosed with precancerous cells every year in the US. And about 4,000 women will die from cervical cancer every year in the US. The International Agency for Research on Cancer found that 13 HPV types can cause cervical cancer. And the types of HPV that cause genital warts are not the same types that cause cancer. And not all HPV types cause genital warts. So you cannot go around defaming people because they have HPV. Most people who become infected with HPV will never know that they have it. They will get it and clear it without ever knowing they even had it. By age 50, at least 4 out of 5 women will have been infected with HPV at one point in their lives, and that is according to the CDC. HPV is also very common in men, and men usually do not have symptoms. So, Granny had gone in 2019 for her annual pap smear. She was found to have precancerous cells along with HPV and something called LSIL, which is abnormal cells. And she was supposed to come back the following year to make sure she got her next pap smear because she did have those abnormal cells that could develop into cancer. Now, again, just because you have HPV does not mean that you have genital warts. So the people like BJ or the people in BJ's chat that are going around saying that Granny has warts or by calling her G-word, all of that type of stuff is defamatory because that is not something she has. Because you are ignorant and have not looked into anything, HPV is not just one type. There are many, many types of it, and they all cause different symptoms, as well as the ones that cause cancer and the ones that don't. So when you are up there making fun of someone for testing positive for HPV, you are probably mocking most of your audience because even if they don't know it, most have probably had it. The CDC is saying 4 out of 5 women will have it at some point in their lives. So when Granny went, she did have those abnormal cells that were cause for concern. Now, that was in 2019. Of course, the virus happened in 2020. So that kind of threw things off for her. And then she ended up not going that year, but not going again until 2022. And the reason she ended up going in 2022 was for a symptom she developed. And I refuse to go into detail about this symptom, as some people have disgustingly done in their community post, just to try to embarrass her. So I'm not going to do that. But so she went in to her doctor the following day after she developed this. And again, this happened to be one day after the whole journal entry sharing event happened. So tell me again how Granny planned that. Okay. In the multiple videos made of this, you will see April 9th, 2022 as the date, and you will have multiple cut clips of things that Granny said on that day and the following day. So let me go to that day, April 9th, 2022. So Granny had been to the doctor that morning, had been told that it was suspected that she could have cervical cancer, and more testing had been ordered. So what she explains is while she was at the doctor, she had received a lot of messages from her mods and from a lot of people, and she was kind of flustered. And so she responded to mod chat. So what happened then is one of her mods, named Gmail, went into another chat, and then you're going to hear a story from the people that dislike Granny that are going to say that Gmail just went into another chat and said, Granny's sick and needed prayers. And then they claimed that Granny went live and went off the handle playing victim. So that's what you'll hear. What actually happened was Gmail went into another chat and asked for prayers for Granny and said that she had received bad results from the doctor that morning. So Granny went live to explain because you know that her phone would have been blowing up with people wanting to know what's wrong, what's going on. People would have been coming into her chat if she had gone live about something else, or in her comment section, asking her over and over, what's wrong, what's going on, what's happening, because shit spreads like crazy in this community. You can say something and it will be all over the community in 2.2 seconds. So I understand why she went live. She was addressing it before it even got started. And of course, they want to say that she brought this to YouTube to distract from the journal situation. But again, I think she came live about it because she was trying to keep from getting bombarded. And so, yes, on April 9th, when she went live, she said she had gone to the doctor and they said she had cervical cancer and had ordered testing. And she says that the nurse did the pap and said she had a friable cervix and said, I think you have cancer. She said that they had asked her to make sure she has a will. And she commented that she's 33 years old. What would happen to my kids if I died tomorrow? YouTube really isn't on my mind. And so the controversial statement is at this time, Granny was friends with Kim. And so Kim was in the chat and had asked her something. And so she responded and said, no, Kim, that was 2019. It actually progressed already. It's full blown. This was right after her doctor visit. So then on April the 10th, she comes on and she claims that she never said full blown. She just said she needed further testing. So here's my opinion. And this has been my opinion since the day it was said. And I didn't even really like Granny at that time. The whole full blown statement, this is a big point of contention, okay? My opinion on that is what she meant by full blown was not that she has full blown cancer. She was stating that her precancerous cells from 2019 were now full blown cancer. They went from pre-cancer to full blown cancer. Not that she had full blown terminal cancer. I never took it that way. I don't think she meant it that way. And so this is what I talk about that people do. If you dislike someone, you can take any sentence and turn it into something nefarious or untrue or whatever. You can rip it apart and find something. So the thing with the whole full-blown statement, because this has been one of their big points on why Granny faked cancer, is the fact that she said full-blown. They have focused on this ever since it happened. You know, it's been a main focal point of videos. It's been a main focal point of community posts. This is all a big thing. So here's my thing. And I don't know if it's because I'm a nurse or if I'm just a human. But when I look at things, I try to take into account emotion, human emotion. People sometimes look at creators as if they don't have emotions and feelings and reactions and anger and fear and sadness. And, they're not allowed to have any of those. It's just they're robots and they come on here and everything they say is correct and they never make mistakes. They never misspeak. They don't ever react out of anger. Well, that's just not possible. So when I'm looking at something, I'm looking at the emotion behind it too. But in this case, I'm actually looking at the sentence that she used it in because it was literally, no, Kim, it was 2019. It actually progressed already. It's full blown. To me, this is not saying I have full blown terminal cancer because that's what everybody's trying to make this. That she said it was end stage cancer because she said full blown. No, in my opinion, this is somebody that isn't around medical stuff a lot. She doesn't have a lot of things wrong with her. She's not in and out of doctor's offices and medical places all the time. And quite simply, she's meaning the last time I went in 2019, these cells were not cancerous. They were pre-cancerous. Now I've gone and they're cancerous. So it has progressed from pre to cancer. And so that's what she was meaning by full-blown cancer. That it's not just precancerous, it's not just abnormal cells, it's full-blown cancer, okay? And so then people want to go to April the 10th, the next day. She denies that she said full-blown. And this, I think, and I have not talked to her about any of this. This is all the way I perceive it, the way that I interpreted what she said, and the emotion behind it. So this is all me. But I think that either she realized that people were taking full-blown to mean end stage cancer and she was embarrassed that she said it that way, or she truly didn't remember saying it because it was a very emotional day. And when you're in high emotion states, you can forget things that are said. Also, Granny does have a short-term memory issue because of a car accident where she sustained a head injury. So I think all or any of those could have played part in her denying it the next day. And so then people are going to say, okay, well, she at this point had only been for her pap smear. She does not have definitive results that it's cancer. So I don't know if you've ever been in a situation where you yourself or a loved one, you've been at the doctor's office and they bring up the word cancer. When that happens, everything turns to panic and that's all you focus on, cancer. I know this because when my youngest was 18 months old, he had a lymph node in his neck that was very firm and was growing in size. So after a couple of months, when it was growing and wasn't going down, we went into the pediatrician and he said, I want to send him for a biopsy. I'm afraid this is cancerous. My world stopped. Like I don't even remember what was said in that discussion after that word was said. I actually the next day had to call back and have them repeat the instructions they had given me because I literally shut down when I heard the word cancer. There were so many thoughts that ran through my head and it was all about what is going to happen. How are we going to handle this? What are we going to do if it is cancer? What steps are we going to take? How are we going to financially, all of this was like running through my head, along with just fear that my baby might have cancer. And I think that's a normal response for a lot of people. If you are somewhere at a doctor and you know that you've already had something that they have said was precancerous, and you go in and they're looking at things, and yes, they can get a pretty good idea of whether or not it's progressed. Can they say definitively? No, of course not. It has to be tested. It has to be sent to pathology. But especially people that have had a lot of experience doing pap smears, they learn what the cancers look like and what signs are there. So do I think they could have told her, I think you have cancer? Yeah, I do. To go back to my story, it doesn't matter how it's said, who says it. The moment someone says, I'm afraid this is cancer, I think this may be cancer, you have like an out of body experience. It is terrifying. Okay. So then you take somebody who is not familiar with medical terminology, is not at medical facilities a lot, has not had a lot of medical things wrong with her, just not familiar with the words used, what they mean, and everybody complains about her grammar all the time. She has her grannyisms or misspeaks sometimes, but everybody kind of wants to just overlook that whenever we're looking at a situation where we could actually, say, okay, well, she didn't understand it or she said it wrong. Then they don't want to say that she has bad grammar. They're just going to say, oh, well, she knew it and she's lying. So, of course, the people that dislike her don't want to give her any grace, and that happens on both sides. I'm not going to say that's just a BJ side thing. But so do I think that Granny misunderstood some things in that appointment? Yes. Do I think Granny used the wrong words to describe some things? Yes. Do I think she was terrified about what she had heard and genuinely was terrified of having cancer? Yes. So let me break this down a little bit. So, can a doctor diagnose cervical cancer while doing a pap smear? No, but they can definitely see signs and symptoms that are highly suggestive of cancer, especially when there's a history of HPV and abnormal cells on the last pap smear that was 3 years ago. After all, pap smears are most commonly used to screen for and detect the possibility of cervical cancer. An abnormal pap smear is called a positive finding. And some positive findings are cervical lesions, bleeding on exam, masses, and a friable cervix. Because Granny said a nurse had told her she had cancer, I'm going to assume that it was a nurse practitioner that was doing her pap smear because regular nurses don't do those. And again, that's just a medical knowledge thing. You hear nurse, you not differentiating between a nurse practitioner and a registered nurse. Um, so she had a history of HPV and abnormal precancerous cells 3 years prior. And now she has this new symptom of abnormal bleeding. So then when they do the exam, she has a friable cervix, which means the tissue tears and bleeds easy. And a friable cervix is a sign that can signal cervical cancer. It's a significant symptom that increases suspicion of cervical cancer. The predictive value of a friable cervix for cancer is moderate. During a pelvic exam, the doctor will not be able to see precancerous changes in the cervix. However, they may be able to see signs of invasive cancer. Any suspicious findings will be further evaluated. And this is what we heard from her, was that they had ordered further testing after this initial visit. So based on her medical history, new symptoms, and the findings on exam, the nurse practitioner can be highly suspicious of cervical cancer. And then people were saying that they can't tell you they think you have cancer because they don't know that and they're liable for it. And no, they can say, I think you have cancer, or this is highly suspicious of cancer. They can say that. They can't say, yes, you have cancer definitively. But yeah, they can say, I think this may be cancer. This really looks like cancer. They can say those things. That's not a medical no-no. It's okay to do that. And they can especially say that whenever this is a patient who had precancerous cells 3 years ago and didn't come back for their follow-up the next year, but waited 3 years to come back in. Because if a nurse practitioner is looking at all of these signs and symptoms and saying that this could really be cancer, they want her to come back in to get the further testing. Whenever medical professionals see someone who doesn't follow up regularly or who doesn't follow doctor's instructions about coming back in, they're going to do or say things to make sure that the patient understands the importance of listening to their orders. So if they say to her, what they're thinking, that this could be cancer, it's really suspicious of being cancer, you have to come back in for testing, things like that. So, and unless this doctor or nurse practitioner is brand new, they have seen numerous cancers and they learn what the typical physical exam symptoms are for those cancers. So, yes, she could have said, I think you have cancerous cells. I think that your precancerous has progressed to cancerous based on what I'm seeing, but we need more testing. They absolutely can say that. As far as Granny saying that they asked her if she had a will and that really upset her because she's 33 years old. And what would her kids do if she died tomorrow? And look, I don't think that this was a ploy to try to get people to believe she's terminal. I think these were normal thoughts and emotions for someone in their 30s who has been told that they might have cancer. I think that these are normal thoughts. What happened with the will is, I think once the virus hit and we went into the pandemic, there became an increased focus on living wills and advanced directives because we now had a lot of younger people who are healthy that were passing away from the virus. There became a push to now ask every patient if they have a living will or advanced directive and encourage them to do it. So if you're not at healthcare facilities a lot, if you're not at a lot of doctor visits and they ask you about a living will, are you going to understand right away what that is? No. You're going to hear the word will and automatically think, last will and testament. What they were probably saying is asking about a living will. And we in healthcare encourage everyone to have a living will and advanced directive. But lots of people have no idea what that is. So again, I don't think this was a big thing used to get sympathy and say, I'm terminal. I think that they asked her about a living will She didn't understand that that was different from a last will and testament and thought that's what they were talking about. And I think she was emotional about that day. And I think that question probably added to it. Because if you don't understand what you're being asked, you've just been told that you have something suspicious of cancer, and then they're talking something about a will. Yeah, I can understand the panic and anxiety that would come from that. And that's just a misunderstanding of that medical term. And so, as a nurse, I'm going to take this moment to talk about how important it is to have a living will or advance directive. And if you don't know what that is, it is a document that tells your wishes. So if something were to happen to you and you can't tell people your medical decisions, if you can't express your wants and needs, it is something that tells the doctor what you want done in a scenario where you can't tell them, or you can designate someone to make those decisions for you. And I understand that death is not a popular topic. It's hard to talk about. Nobody wants to talk about it. Working in hospice, death is like it's not a voodoo topic to me. I talk about it all the time. So even though it's a hard discussion, it's really, really important. Even if you don't complete a living will, talk to your loved ones about your wishes. Talk to them about things like, would you want to be on life support? How long would you want to be on life support? Do you want artificial nutrition? Do you want to be intubated? Things like this. They need to be talked about because it helps your loved one to handle the situation a little better and not have guilt. So what I'm saying is someone gets into a horrible car accident. They're in a coma, in ICU. They're on life support. They've been on life support for 2 weeks. It's not looking good. So the husband is approached and he has to make decisions. And he's had to make decisions all the way about whether or not to have his wife intubated, whether or not to have tube feedings, whether or not to keep her on life support. At a certain point that you're on a ventilator, they're going to want to switch it to a trach and do a tracheotomy. There's so many decisions, and when to remove life support. So you have a husband who is already going under immense emotional stress and turmoil. And on top of that, he has to make decisions that he has no idea what his wife's wishes were because they never talked about it. So he really struggles with the decision to remove life support or not because he doesn't know. And in his mind, he's thinking, what if I tell them to remove it and then I feel guilty because maybe I didn't give her long enough. Maybe she would have wanted it done this way. All of those things float around in people's heads when they have to make these decisions. If it's somebody that doesn't have a spouse and they have multiple children, then you get fights among the children on who wants what done, and one wants it this way and one wants it this way. And a living will or advance directive clears all of that up. It takes that part of this stressful, emotional situation and makes it easier. Now, I'm going to say it doesn't always, because they don't have to necessarily follow what you've put in there. I don't know if that differs state to state, but in my state, even though it is a document that has been notarized or an attorney has done it, the people making decisions don't have to agree with it and do those decisions. So you want to assign someone to make decisions that is actually going to be able to follow through with what you're wanting. I hope that makes sense. I feel like that was confusing. So let me wrap that up and re-say it. So Advanced Directive of Living Will is a document where you lay out your wishes or assign a person to make decisions when you are unable to make them on your own. If you don't do that, at least have discussions with your closest loved ones about those situations and what you would want done so that they know. And if that time comes or something happens, they don't have to question it. They know already what you wanted. It's super important. I don't care if you're 20 or 70. It's super important to do. Again, it's super easy to confuse a living will with a will and testament if you're a young person without a lot of medical problems and you haven't heard it before. And the virus definitely began a push in most healthcare facilities to ask every patient if they have a living will. It used to be just that we asked older patients. We didn't really focus on the younger ones. But after the virus, whenever we had a lot of younger people passing away unexpectedly, it became a push to get everybody to do a living will. So I understand that. So as you know, there's numerous stages of cancer. And again, I did research a lot of this. I'm not coming out here talking out of my ass. Like, I researched a lot of this. I used my prior knowledge, my medical knowledge, my experiences in life, and then a lot of researching all of this. Okay. So what I found used most frequently is the FIGO staging system. And that's the International Federation of Gynecology and Obstetrics. It's a staging system that's frequently used for staging cancers of female reproductive system, including cervical cancer. So under FIGO, the stages of cervical cancer range from 1 to 4. Although stage 0 is sometimes used to refer to abnormal cells that have not grown past the surface level of the cervix. And so once there is that pap smear done and there's all of these risk factors and suspicion for cancer, then she was sent for a colposcopy. So a colposcopy is a lighted magnifying instrument attached to magnifying binoculars used to examine the cervix. And they can perform biopsies at that time. And the biopsies they take here is to determine if there is cancer present and to stage the cancer. And cervical cancer can be treated multiple ways depending on the type it is and how far it has spread. And treatments can include surgery, chemo, radiation. The extent of the disease is referred to as the stage. So there's a stage 0. The first stage of cervical cancer is carcinoma in situ. A group of abnormal cells has started to grow but has not yet spread to nearby tissues. Because stage 0 precancers are likely to eventually spread deeper into the tissue and become cancerous, they need treated. Then there's stage 1. This cervical cancer has formed and is formed in the cervix only. It is divided into stages 1A and 1B based on the size of the tumor and the deepest point. And then, so stage 1A is then further subdivided based on the deepest point of tumor invasion. This is so complicated. Stage 1A1, a very small amount of cancer that can only be seen with a microscope and is found in the tissues of the cervix. The deepest point of tumor invasion is 3 millimeters or less. Then there's stage 1A2, a very small amount of cancer that can only be seen with a microscope, is found in the tissues of the cervix. The deepest point of tumor invasion is more than 3 millimeters, but not more than 5 millimeters. And the cancer stage is important on determining the treatment for it. Stage 1B cervical cancer means the tumor has grown larger, invaded deeper than 5 millimeters, but remains confined to the cervix. What happens is you go into colposcopy, and that is what Granny had. And they go in, and in colposcopy, they take biopsies. And they don't just take one biopsy, they take multiple biopsies from different spots on the cervix. Every doctor will have their own method of how they choose where they take biopsies from. And then those biopsies are sent off. Now, this is the part where someone, I'm sure we can imagine who, released a private voice note of Granny saying she got her nurse called with the results, but she's confused because she said they were cancerous, but then she said benign. And in the voice note, she says, I thought benign meant not cancerous. So it was obvious that she was confused by the results. Understandable, again, if you're not familiar with medical terminology or with procedures. And so this is something that happens a lot in today's world because you have doctors who, so let me explain it this way. So insurances have cut what they pay doctors for in-office visits. So to make up for the loss of payment that they're receiving, because insurance is now paying less, they are trying to see more patients to make up for the loss of income. So now they're seeing twice as many patients in a day. So that means when you go in, they're spending less time with you because they have another patient waiting on them. And this becomes a problem because doctors aren't sitting and explaining things to you. They're not having discussions with you about a new diagnosis or a new medication. It's just not happening. And when I was working hospice, it was amazing to me. I would walk into a new referral and it amazed me how little the patient and the family understood about why they were being referred to hospice, understood their disease process, even understood like what COPD is, what it's doing to them. Patients don't understand what is happening to them anymore because doctors don't take the time to sit down and explain it to them. So this is where, as a nurse, I'm going to tell you, be your own advocate. It's so important to stand up for yourself, advocate for yourself. If your doctor isn't explaining something well enough, ask questions. If something sounds off to you or doesn't sound correct, ask questions. Don't be afraid of making them mad or hurting their feelings or whatever. What is important is your medical care. And if you don't understand it and they're not explaining it appropriately, ask. Please ask. So this is what happened when Granny received the call saying she had some biopsies that were benign and some that were cancerous. So this voice note does not prove that she was faking cancer. It actually proves that they called her and said some were benign, some were cancerous. So that is what that little voice note means. Not that she's lying, but that she had both kind of biopsy results. So then once you have your biopsy, you have your stages. So stage 1A1 treatment is cold knife conization or cone biopsy. And this is a fertility-sparing procedure for small cancers. Or you have total hysterectomy with or without removal of ovaries. And this is for patients who have the type of cancer that has a high risk of coming back. Stage 1A2 treatment is a modified radical hysterectomy and removal of lymph nodes and or internal radiation therapy for patients who can't have surgery. And then another option is a LEAP procedure, which is a loop electrosurgical excision procedure. This is an electrical current through a thin wire loop that's used to remove sample tissue. And this is done in the office and is a very short procedure. They do that and or the cone biopsy, which is a more precise removal of a cone-shaped piece of tissue from the cervix with a scalpel. And you're not always referred to an oncologist. If you have one of the lower stages of cancer that is confined to the cervix and not deep, and that can be removed with a LEAP or a cone, you're probably not going to be referred to an oncologist. You can ask to be referred, but that is not necessarily something that happens when you have a low-grade cancer. So what Granny had done was a cone biopsy. And when you have that done, so they remove the cone-shaped piece of tissue and they send it down for what's called a frozen section. And this is where the pathologist in-house looks at this they stain it, they look at it under a microscope. And this is to make sure that the margins are clear. So they want to make sure that the tissue they removed where the cancerous tumor was, that is all removed, that the edges don't have any cancer in them. So they know that they have all of it out. Okay. And so they'll take their biopsy or they'll send it down. This is confusing if you don't know medical stuff, but send it down for frozen section. Pathologist looks at it, says, you're good, you got all the cancer. So then they finish the procedure out. So at that point, you don't need radiation, you don't need chemotherapy, you have gotten all of that cancer. And then you just have more frequent follow-ups with your QIN because it can recur again. So radiation is only used when cervical cancer has spread beyond the cervix, or if you have a large cancer in the pelvis, you can't have surgery, or you need to shrink a tumor before surgery. That is, I think, covers everything. So my basic review of this is, whenever she said full-blown cancer, the way that it was being said in that sentence was, I had precancerous cells, they are now full-blown cancer cells, meaning they're fully cancer now, not meaning I have end-stage cancer, okay? And I know everybody kept coming out and said, nobody says end stage unless they're talking about stage 4 cancer. And okay, yeah, if she came out and just said, I have full-blown cancer, that's one thing. But she's having a discussion with someone where she says it was precancerous and now it's full-blown. That means it has progressed to it's full-on cancer now. It's not precancerous anymore. I don't know why that's hard to digest. And the next thing was, did she get diagnosed with cancer at her pap smear the first visit? No, she didn't. But she likely got told that they are highly concerned about cancer and that her symptoms and the fact that she had HPV and precancerous cells 3 years prior, that it is highly suspicious for cancer and that they are really, really concerned about that. I explained the living will thing. I do not think they were asking about a will and testament. I think they were asking about a living will. And at the age of 33, she had never been asked that before. When she went back to the doctor, it was 2022. It was after the virus and the pandemic. They were now asking a younger generation about living wills. Oh, what else was there? That was the pig. She's faking cancer. Okay, so we've got full-blown cancer, diagnosed with cancer at pap smear. You don't always get referred to an oncologist for a low-grade cervical cancer. That can be removed with a in-office procedure. When she had the pap smear and it looked suspicious, she got scheduled for colposcopy. She went for colposcopy. They took multiple biopsies, which they normally do. They called her. We hear a voice note where she says, I'm confused because the nurse said it was cancerous, but then she said benign, and I thought benign meant not cancerous. And everyone wants to say, so this was where she was lying to everyone and saying that it was cancer when it was benign. No, what that meant was the nurse called and said some were benign, some were cancerous because they didn't take just one biopsy. They take multiple, okay? The next thing that she had done was a cone biopsy where they take a scalpel and they remove a cone-shaped amount of tissue around the cervix. They do frozenception where they send it down to a pathologist who stains it, looks at it under a microscope, and says, yeah, the margins are clear, you have all the cancer. They end the procedure. You then get more frequent follow-ups. You do not have to have radiation or chemo, okay? That wraps it up. There is no faking cancer. So everyone that's posting that everywhere, saying it, spreading it, that is literally defaming her. Because again, like I said, what the court cares about is if there is a medical paper that says cervical cancer on it next to a biopsy and has a stage of that cancer, that's what they care about. They don't care about what she came on and said on YouTube that y'all took to mean one thing or another. If you're going around saying she faked cancer and she has medical proof that she has ab cancer, sorry, that's defamation. Because if people think that you fake cancer, you're pretty much, that's a pretty low thing to do. So if you're doing that, it's going to harm your reputation on YouTube. If your reputation is harmed, you lose views, you lose opportunities to work with other creators. I have seen other creators who used to like Granny now in chats saying they don't mess with cancer fakers and they don't have any respect for people that fake cancer. Well, she didn't. Sorry. I don't know all the details about the fundraiser. I know that there were 2 links to fundraisers made. One was never dropped. And the person that keeps showing the fundraisers is showing both of them, but they weren't both utilized, if that makes sense. And it was for a vacation to Florida. I don't know if it was a thing where she had already wanted to take a vacation to Florida that summer and was going to do a fundraiser anyway, or if it was something where when she first heard that there was a good chance that she had cancer, that it was an emotional reaction that she wanted to go and take a trip and do something, because it is an emotional thing. I'm sorry. I don't care if people think it's insignificant because it was just a stage 1 cervical cancer. When you hear you have cancer, it is not a little thing. It's emotional. It doesn't matter. And at that point, she didn't even know what stage it was, how advanced it was, what was going on, right? So did she have kind of a knee-jerk emotional reaction that she wanted to take a vacation to Florida with her kids? Maybe. I don't know. I'm not her. But I do not remember her ever saying she needed money raised for cancer. I don't ever remember that, and I have not seen proof of that anywhere. So, the amount that she was asking for to be raised was not enough for our family to go to Florida. So she ended up using it for her daughter to take a trip with friends. None of my business. I didn't donate. I'm sure some of these people out here complaining about it didn't donate. So whatever. It is what it is. Y'all can take that part of it, because I'm sure now that I have laid out everything about she didn't fake cancer part, they're going to focus on the cancer scammer part, which I don't think happened either. And I've not seen proof of that. So I don't know. I think it's ridiculous that we are to the point of accusing people of lying about cancer simply because she would not lay her cancer results out to YouTube. Of note, she did not lay out the medical information that got put out. She shared that with a friend who then shared it with Natasha Cooper. So she did not put that out. I think that's it. There's going to be more of these voice notes where I'm going to talk about things that are being spread around that are being twisted to look a certain way, but aren't that way. Because there's lots of that going around, and a lot of it is actually defamation. I hear BJ over there yelling defamation over everything, because things like spreading to everyone on YouTube that someone faked cancer is defamation. Okay, so that's all for this one. Like I said, there will be more of these, and I'm just trying to look at things logically and understand that creators are not robots. They have emotions. They misunderstand things. They misspeak about things. They are not knowledgeable about all things in the world, and it's okay. I can understand people speaking out of emotion, people feeling emotion, and what comes of that. So I hope everyone has an amazing day, and I will be talking to you again soon.